Hello everyone, my name is Maharlika Diarse. I'm going to be doing NG tube insertion skills video. Before I start, I have my hair tied back, nothing on my nails, Nightingale badge, Nightingale scrub top, Nightingale scrub bottom. Miss Smith, our patient, basin with warm water. I have tape. I already ripped out some tape and put it on a clean surface, so when I'm ready I can just put it on. Specimen cup and my pH test strip. I'm going to pretend that this is a pen light just to look into the nares. Lubricant jelly, my 10 to 60 cc syringe, gloves, safety pin. Let me just put that over there. My stethoscope is over here, just out of frame. Suctioning tube, and this is the gastric sump tube. I already took it out of the packaging. Of course, in the real world, everything is packaged, but right now I just took out everything, and let's just pretend. And then my absorbent pad. Alright, let's begin. So I'm gonna gather all my supplies, walk in, knock on the door, provide the privacy curtain, and then place these on a clean flat surface. Wash my hands. I'm going to introduce myself to the patient. Hello, Miss Smith. My name is Maharlika. I'm going to be your nurse today. Could you please verify your name and date of birth? I'm going to check her wristband, and then check it with the orders and everything. All right, verified everything. Okay, perfect. Miss Smith, you have a doctor's order that we are going to be suctioning out some stomach content from your stomach with the NG tube, and because you have blockage. All right. If you have any questions or concerns, please let me know. Right now I am going to wash my hands again. I'm going to put my gloves on. All right, Miss Smith, I'm just going to check your nostrils, your nares. I'm going to check her nares with the pen light. Before I check the nares, Miss Smith, I need to position you in a comfortable position, so a high Fowler's position, and she's comfortable. All right, and it is with my height to the bed for proper body mechanics. All right, let's just pretend that I'm standing up, and here's Miss Smith at a high Fowler's position. All right, perfect. Miss Smith, you're okay? All right. So now I am going to get the pen light, and I'm going to check both of your nares. So then I'm just going to check both nostrils. Can you please look up, please? All right. I'm going to check both nostrils to see if there is any abrasions, contusions, or any deformities in the nares. There's none at this moment. All right. I can put this away. Alrighty, and both nostrils look good. The septum is midline. Everything looks great. All right, Miss Smith, if you could please plug one nostril at a time and breathe in and out. All right, so she breathed in and out on the left and the right. So well, now I'm going which nostril do you feel comfortable putting the NG tube in, Miss Smith? The left. Okay, so we're gonna go in the left. So her left would be on this side. All right, Miss Smith. So now I am going to take the NG tube out of the packaging, and now I am going to measure. I'm going to measure the NG tube from the tip of the nose to the ear lobe, and then from the earlobe to the to this xiphoid process. Alrighty, and the xiphoid process is at around like 50 centimeters. Alright, so now that we got that done, so it's at 50 centimeters, and now I'm going to place the NG tube into the warm water basin. Let's pretend that it all fits in there. It all fits in there, and then so you can make sure that the NG tube is a little malleable, and now I'm going to open up the loop. So I can place the absorbent pen right here, just in case anything happens. The lube is open. Alright, and the specimen cup would be right here, and the pH strip. Alright, and then now I'm going to make sure that when we do this process, we're going to make Miss Smith tilt her head back, and we're going to slide the NG tube in her left nostril. Alright, so Miss Smith, I'm going to take this out of the warm basin. Warm basin, and then now I am going to dip the NG tube into the lube. Let's just leave that into the lube. One moment, please. I'm going to grab the cup of water for Miss Smith. It's just right here. Miss Smith's bed was locked, and it was safe and everything. All right, here is Miss Smith's water. All right, and then I did not leave her unattended. I just grabbed it from the other, from her side cabinet. All right, so now I'm going to insert the NG tube. I'm going to take this out of the basin. I'm going to insert this into her left nostril, and alright, Miss Smith, you're just going to tilt your head back. If you feel any discomfort or anything, please let me know. So I'm going to advance slowly. Alright, so if the patient will start to gag, and we will pause and have the patient tilt their head to their chest and swallow. And then as we're doing this, she can also drink some water as she sips. And I'm going to advance every 2 to 4 inches every time she swallows. Now if the NG tube does not go in and we're kind of stuck, we have to take it out and we have to go into the other nostril. But in this case, the NG tube is advancing well, and we are just going to advance 2 to 4 inches at a time. Oh my god. 2 to 4 inches at a time. That did not happen. And then, all right, Miss Smith, are you doing well? Okay, perfect. All right, so 2 to 4 inches until we see that 50 mark. Alrighty. Once we see that 50 mark, we are good. 50 mark, okay. I know it looks a little crazy over there. Alright, so I already pre-did the tape, so I'm going to hold the NG tube to place right here, and I'm going to just hold it with I'm going to tape it onto the midline. into the middle of the nose for now. If it wants to come off. Alright, for now. Alright, and then now I already ripped this one in half into the middle, so then I can gently place the tape onto Miss Smith's and to secure it. It's a little sticky. We're going to do it around. Like so, into the tip of the nose. Alright. Perfect, Miss Smith. I'm going to clamp this. Alright, everything is good. So now that the NG tube is in place and on the nose, we are going to put this out of the way. We are going to get 30 cc's of air. 30 cc's, I don't know if you guys can see it, 30 cc's. And we are going to pump it into Miss Smith's NG tube. Excuse me. Miss Smith, I'm just going to pump 30 cc's into your NG tube. I'm going to unclamp it. Oh my gosh. I'm going to unclamp it. And I'm going to pump 30 cc's into clamp it, and I'm going to pump 30 cc's into the tube. Put it in. Alright, so while I'm holding this clamp, I'm going to suck out 10 cc's of stomach content. Alright, I got the stomach content. Perfect. Alright. So now I got the stomach content. Take that out. Put that in. I'm going to unclamp it. Plug it back in. Alright, everything is good. And now I'm going to put this into the specimen cup. Now that is into the specimen cup, I'm going to put this back here. And I'm going to put the pH test strip right here. Alright, perfect. So now that the NG tube is clamped, I'm going to put a bobby pin. I'm going to put a bobby pin and clip the I'm going to clip the NG tube onto her gown. So I'm going to clip it onto her gown. Alright, it is clipped onto her gown. So then now that we clipped it to her gown, now we are going to call X-ray to make sure that the NG tube is placed correctly. And once they call us back and they verify that the NG tube has been placed correctly, so they called us back, everything's placed correctly. Now I am going to put the suctioning tube. I'm going to unclamp this and put it into the suctioning tube right here. Specimen cup is there. Now I am going to hook this onto the, make sure there are no kinks, no kinks or anything. Alright, perfect. So now I'm going to hook this up onto the suctioning tube. Make sure that the suctioning tube is getting the contents, not make sure that the suctioning tube is not high, not too high. All right, so everything is perfect, and we will look at the color and the stomach content that is being suctioned out of the tube on the wall. Alrighty, Miss Smith, I'm going to clean up here now. I'm going to clean up all my mess, throw everything away. I will see that the pH is 2. All right, I'm going to document everything. Before I can document everything, I'm going to put Miss Smith in a nice comfortable position. Miss Smith, are you okay? All right, I'm just gonna here's your call light, and if you need us, please let me know. I put everything away. I'm going to take off my gloves, throw everything away in the trash, wash my hands. I'm going to document everything and let the doctor know the procedure and everything, and the pH level. All right, thank you so much.